The indications for having a surgery on your carpal tunnel syndrome to decompress the median nerve are pretty simple. If you're having progressive neurologic loss, for example, weakness of the hand, and especially numbness of your hand, it's probably in your best interest to have your nerve decompressed. And that's assuming that the conservative management or the non-surgical issues, for example, the brace and the anti-inflammatory medicines, have failed. We're assuming that you've already tried to change your behavior, and when all that fails, the surgical management becomes necessary. So with the indications being progressive neurologic loss and pain, the goals of the surgery follow suit. The goals are anatomically to get the pressure off the nerve. Once the pressure is off the nerve, generally speaking, if it isn't permanently damaged, it'll prevent further weakness, it'll prevent further numbness, and it'll maximize your potential to get your function back. Almost always, I can greatly diminish the amount of achiness from the nerve compression in your wrist. I want to try and describe the surgery of decompressing the carpal tunnel and freeing up the median nerve at the wrist using my own hand. And on my hand, my median nerve is coming down, and then it comes to about here, then it spreads across to this side of my hand, providing sensation and motor involvement. Now, the main compression is going to be about from about here to here. And what's happening here is that you have carpal bones lined up on the back, and then you have a ligament above, and then 8 tendons go through there. Those are the ones that move your joints. And then also in there is one nerve. That's the median nerve. Now, tendons are very hard, and they don't compress at all. A nerve is very, very soft, very compressible. So if you're doing a lot of movements of your hand, the tendons can get swollen. And if the tendons get swollen, it's at the risk and at the unhappiness of the nerve. So the nerve starts to get compressed and it starts to not function properly. Thus the weakness and the numbness and the pain. So what the surgery does is simply a small incision from about the wrist crease for about 1.25 inches, and I dissect straight down to that ligament up above, and I simply transect it. I cut through it, and it retracts all by itself. I will then look at the nerve and make sure there's nothing else touching it, make sure that it's open and free. And although the incision's only here to here, 1.25 inches, I'll dissect down all the way to your back in your forearm to about here to here by picking the skin up and cutting underneath it, make sure that the nerve has no pressure on it. But the incision's only about 1.25 inches.